Hi, and welcome to the Cap Your Cast. I'm your host, John Walkup, and today we're joined by rock star Andrea Lowe. She is a physician assistant. She has a master's in health administration. She's also an MBA. Andrea, welcome to the show. Thank you for taking some time to be here. Why don't you tell our audience a little something about yourself?
Yeah, well, first, thank you for having me. I'm excited to be here. So, as you said, I am a physician assistant now, changed the title to physician associate. I'm practicing for 20 years in emergency medicine. Went into some healthcare leadership and administration kind of 6 years into my career. So, I've been a director of advanced practice providers, which are basically PAs and NPs or APRNs. And then went in to be a vice president of operations and really led hospital operations for 6 years before going to the American Academy of PAs, which is the PA membership site. So, in the experience, I've had a lot of experience, and I actually was over medical assistants, scribes, physicians, as well as PAs and NPs. So, kind of know about the dynamics and how important those healthcare providers are important to the whole patient experience.
Great. And so I understand today we're going to be talking about health equity and equality and some of the things that factor into those and why those are so important. So I'm going to give the floor to you, of course. Let's talk about health equity and equality.
Yeah, so I think it's important for all parts of the medical team to sort of understand the importance of health equity and health equality. And the first thing I always tell people is you have to really understand the difference between the two, right? Because health equality is really treating all patients the same, right? And so you're
Mhm.
promoting fairness, but it really only works if everyone is sort of starting from that same place and needs the same help, which is not always the picture of our healthcare kind of environment. And so when we talk about health equity, it's really when all patients and communities have the same opportunity really to obtain like the highest level of health. But the thing is, it really requires the recognition and foresight from everyone on the healthcare team, as well as really intentionally allocating resources to help them reach those outcomes. So it's really giving everyone what they need to be successful. And so recognizing, health inequities in that space are really the differences in health that are avoidable when you address health equity.
Right. And if you're not used to thinking about health in these sort of terms, I mean, what are some of the things you could do to sort of remind yourselves of the difference and on a daily basis?
Yeah, so especially as PAs, and then as what you all are doing, there at Cap Year, where you're having, medical associates. We're usually the first encounter to the patient in their sort of healthcare continuum, as I say. And so, understanding things like the social determinants of health is so important, right? So, understanding that barriers to access is very important to recognize and understand, and treating the sort of the patient beyond the healthcare visit. So things as socioeconomic status,
Mhm.
access to certain healthcare services, even neighborhood and level stressors, and access to nutritious foods. All of those things contribute to that patient's health and their medical conditions, and sometimes they're even more in the patient's medical conditions. So really, sort of understanding those what we call social determinants of health in a patient, and then understanding to ask the questions. So, are you eating nutritious foods? Are you able to get nutritious foods? Instead of coming from a place of this is what you need to do, really asking those questions. Are you able to do it? Right. So really sort of changing that narrative is so
Mhm.
important for everyone on the team.
Interesting. So I like that idea of changing that narrative and sort of, putting yourself on the same playing field, almost as the patient. And I'm curious, what are some of the kind of questions you can ask? I mean, are they really so simple as to say, how are you eating every day? Or, I mean, are there?
Yeah, and from an emergency room standpoint, I always say there are triage questions that we ask all the time, right, for the patient, and one of them really that's required by most states is saying, "Are you safe at home?" Right. So even if
Mhm.
you're going to a clinic visit or emergency room visit, especially when you're seeing patients that's constantly coming back for things as not being compliant with medications, kind of going beyond and saying, well, before you're saying that the patient is not compliant, right, which is really even nowadays an outdated term, asking, well, can you afford your medications, right? Do you have pharmacies around you? We notice your cholesterol is up. Do you live someplace where there's a food desert or you don't have access to nutritious foods? So it's really just baking in the same triage questions that we would ask, when we're doing what we call, the history of the present illness is what we call it when you're coming in. It's really having best practice and making those questions almost part of the healthcare plan, because then you're not going to see the most beneficial health outcomes unless you're addressing it.
Right. And so let me ask this. Sometimes you have the patient, they're sitting in the waiting room, the physician's not in, maybe the PA's not in, it's just a medical
Yeah.
assistant that's sitting there. Is that a special time that the medical assistant can really sort of, I don't want to say small talk because this is anything but small talk, but it's patient facing time that contains valuable information. And I'm curious, how can you use that time to advocate for these patients?
Yeah, that's a really great question. And I'll tell you, just in my practice, MAs have brought stuff to my attention, in the emergency room, or even, in a clinic situation, you're kind of going. And sometimes even you as a provider are like, oh, wait a minute. I didn't ask that, or I forgot to ask that. So again, it could be as simple as if the MA is doing the intake or taking the vitals and they see that their BP is a little elevated. Are you taking your meds? Do you have, and if it's no, instead of saying, okay, patient not taking meds and walking out the room, do that step. Why? Sometimes it could be because I truly can't afford them. I've lost my job. There's so many other factors that can lead to that. And so asking those questions is important. And another thing too is that, one of the things that I always used to have my team do is really be aware of the resources that's around us, right? So wherever I'm practicing, anybody from really the front desk person to the MA to the provider to the discharging physician, whatever it is in that continuum, understanding the resources, understanding, prescription help, understanding places where you can go, food pantries to get nutritional food. Those simple things of just even having the list of resources, you're contributing and even advocating for the patient in that sense.
Interesting. And where can you find? I mean, I imagine that most practices or locations would most likely have a list of resources. But I'm curious: is there a set list of resources or a location where you can find these resources, either online or are there offices in which you can go and sort of understand what the local resources might be for patients who might need that help?
Yeah, so especially one of the things that many people are speaking of and are aware of that's come out of this pandemic that we're in, out of wherever we're going to say that is going on, is understanding that there's so many health inequities, right? And so I think one of the things that we're seeing is the elevation of really resources that have kind of always been there, but places like CMS, the CDC, the National Minority Health Institute. There's so much information out there of resources. And many times, and I know for a fact, the CMS, they have it based off of location and maps on their website, and it's free of resources that you can get. And then really partnering at the community level, I think that's really important as well, right? So, working for an organization that's really saying, okay, so here are all of the community health clinics. Here's what the churches are doing, really kind of getting what I call boots on the ground, and understanding sort of what that environmental scan is for the resources that you have is really not that hard. The hard part is actually having them, right?
Mm-hmm.
But understanding where the resources are from a national to a local level, I think is really important.
Now, I'm gonna try and put this in a little capsule here because I think this is really important stuff. It almost sounds to me that if you're an MA and you're sitting in alone with a patient, perhaps they're waiting for the provider to come in, that you have this window of opportunity. And I'm wondering, first, is their guard a little bit down when they're sitting there with someone who's not wearing the full white coat and has the authority to write prescriptions? Is it a more of a sort of a one-on-one moment?
Yeah, I think definitely it is. Especially because, some patients could have what they call the white coat syndrome, right? When you're walking in like, oh my gosh, I'm on guard. I have to make sure to say this, and that.
Right.
Many times I've had patients tell things to, either the MA or the front desk person, down to not feeling safe at home, that they may not feel as comfortable telling me yet, and so I really think that there's an opportunity for there to be a candid conversation. And so to go back a little bit of my history, I actually was a front desk person in a medical clinic, and that's what I worked at before I went to PA school. And so there were many opportunities where the patient comes in and said, oh, I'm so late. I'm so sorry. I've
Hmm.
just been laid off. I couldn't come in. I had to take 3 buses to get here. I know I'm 15 minutes late. Do you think I could still be seen? Right then and there, that is an opportunity to say, okay, interesting. Is there anything else that you haven't been able to do because of that? Is your health insurance still intact where you'll be able to afford your prescriptions? Because here's the thing, that's many times what, as a provider, we're not going to ask, because we're just there to treat the patient. We don't really
Right.
care if they have healthcare insurance or not. But the issue is you kind of have to change that narrative to, we treat people the same, right? So that's where it comes to that equality. But the equity is, if I give you a prescription that's $250 out of pocket and now you don't have health insurance, well, now I'm not addressing the equity part. And so that's where there's that opportunity for that MA to sort of make that connection and sort of remind. And then, as I said, like, as providers, we're trying to do our best. Healthcare is super busy, more than it's ever
Hmm.
been before. And so having that best practice where the MA is part of that healthcare plan and is looking for things like that. And even, writing a little note, or even coming in the room and saying, hey, the next patient that's in the waiting room, just want to let you know they shared this, this is going on with them. So when you're discharging them, keep in mind that you may have to tweak something or make a call for verification to cover certain things. That is so helpful.
Right. So it's amazing to me because I feel like you're really almost establishing this lower level relationship in terms of, there's the high level, which is like, hey, what is wrong with you today? And how can we
Right.
treat what's going on with you? But then there's that sort of you as a person and getting to know it. And I'm wondering, from your point of view, how does that drive improvements in healthcare?
Yeah. So, and I say it's not even so much like a high and a low level. It's really treating the patient holistically, right? So as I
Right.
was saying, like sort of treating them beyond, but that is a significant part of healthcare, because if you're not addressing, the health inequities, you're really kind of almost shifting what the health outcomes is going to be, because sometimes the social determinants of health can play a huge role in patients' health outcomes, even
Yeah.
more than their medical condition themselves. So it's really doing a disservice to the patient, but also disservice to the provider, because I can't tell you how many times, in the emergency room, this person's come back and their sugar is still high. Well, can they afford the insulin? Can they take the insulin? Do they have a place to store it? There's so many other things that go into that, instead of a patient not just wanting to take their medications, right? And so if you address that before, you can avoid what we call in the emergency room some of the bounce backs. But even in clinics, when you're doing all this healthcare plan and you want to bring the patient's cholesterol down and blood pressure down, but if you're not addressing, you know,
Hmm.
their food intake, what's causing their blood pressure to be high, again, work stressors, socioeconomic status, then you're just kind of going almost in a hamster wheel. You're not doing anything. So you really have to approach it in that holistic approach.
Right. I like the idea of approaching it holistically. And it's not a new concept, but it's one that I think needs new thinking, because I
Yeah.
think the revolution, I suppose, it's not even a revolution, but the idea of healthcare as being holistic is fantastic, and I think it's long overdue.
Yeah.
Andrea Lowe, thank you very much. We appreciate all of your insights. We appreciate you stopping by, and we will certainly have you on to continue this talk. Thank you very much.
Thank you so much for having me.